Yes.
Okay, so premium non nocere and first do no harm. And in the COVID era, what we have been following, and AIOS has given out recommendations, that is to provide urgent and emergent care only. It has been our duty to provide intervention in the sight-threatening disorders as only, and at the same time protecting both patients and ourselves from COVID-19. Now, the SOP for the post-COVID era, and gradually elective procedures will have to be taken up. And however, the COVID-19 situation may be prevailing for few months and do not know how many months. Therefore, we have to remain vigilant. And at the same time, we have to understand that the dynamic post-COVID era regimes protocols will be changing. So SOP for the IoT, which cases to take up in the IoT, and we all know that the cash flow for the post-COVID era is going to be an important area, because that's where every institution, every private practitioner is going to come back to his or her own feet. And this is important, how we space out our surgeries, how we take up the surgeries by and by. Initially, all surgeries should be day care. Emergency cases, of course, to given precedence over elective, and the total number to be limited and posted in a very, very staggered manner. This is important both for our patients, for our staff, and for ourselves. Which surgeries best to be avoided? Any case under GA which can be postponed, maybe more when we have learned and we have a better dynamics, and DCR may be postponed by a month or two if it is possible. Any CAM surgery which is not an emergency needs to be postponed definitely. OT scheduling, pre-operative counseling plays a very, very important part. Just like the OPD, pre-operative OPD counseling is important, the pre-operative counseling is equally or more important. Patient and attendant must be made aware of the current scenario and the risks involved, and the consent that the AIOS has issued must be duly signed and kept safely, hard copies as well as the soft copies. The pre-operative tests to be done. Well, all routine tests to be performed exactly as we have been performing, chest X-ray to rule out active lung infiltrates. And this is something that can be done for all our OT patients. The understanding for a COVID-19 test feasible for the elective patients for surgery. Is it feasible? What the government is going to play as a rule or regulation and the protocol to be laid down by the state health department is all very, very important. And if possible, a tie-up with a lab, if possible, will definitely increase the safety of the staff and patients alike. However, as I said, health is a state subject and the government protocols need to be followed. The pre-operative precautions to be followed, to the patient to enter with one attendant, and masks, of course, mandatory for the patient and attendant. Patient masks to be changed before the patient enters the OT, and norms of social distancing, of course, to be there. The per-operative precautions to be followed, number of OT staff as minimum as possible, guidelines for OT gowns and protective wear for the OT staff, and these things will definitely be deliberated, and in the coming week we'll give a guideline from the AIOS. Quick and safe surgery to be performed by seniors preferably, and all universal precautions is to be taken. Topical anesthesia over local anesthesia is better. No two patients to be handled together, which is important, and the protocol-based disinfection of the OT to be done after each surgical procedure. Stop positive ventilation in the theater during procedure or at least 20 minutes after the patient has left, and smoke evacuation after the diathermy. Aerosol generating procedures such as intubation, extubation, bag masking, electrocautery to be done by the anesthetist. And at this point of time, possibly PPE is important. A word about HCQS prophylaxis. The ICMR has advised oral hydroxychloroquine 400 milligram BD on day 1, followed by 400 milligram OD weekly for 7 weeks. Now that is an individual discretion, and again, what the government guidelines go. Important to remember that no suspect or confirmed cases to be scheduled for surgery. Let us refer it to facility with ICU, and mask mandatory for patients undergoing major or minor surgeries. And these are absolutely extraordinary times and calls for extraordinary measures. Thank you, Dr. Mayapal sir, Namrata, and the whole team responsible for the wonderful webinar.
Thank you very much.